Welcome to the Estrogen Dominance Podcast, where we explore the latest research on estrogen dominance, its causes, and its effects. In this episode, we'll be discussing the 20 signs and symptoms of estrogen dominance that you may be experiencing. Don't miss out on our upcoming episodes. Be sure to subscribe to the podcast to stay updated on the latest insights and tips. In today's episode, we'll cover estrogen dominance, bioidentical progesterone, the association between estrogen dominance and autoimmune disease, the use of low-dose naltrexone and natural bioidentical progesterone to restore immune and hormone balance and aid weight loss in estrogen-dominant patients, and how to find a healthcare professional who specializes in hormone therapy or autoimmune conditions.
Have you ever heard of estrogen dominance? It's a condition where there is an imbalance between estrogen and progesterone levels in the body, with estrogen levels being relatively higher. And this can lead to a whole host of symptoms. Today we're going to talk about 20 signs that may indicate estrogen dominance. Let's dive in. First up, we have irregular or heavy menstrual periods. Estrogen dominance can cause changes in the menstrual cycle, such as longer or heavier periods, or irregular bleeding. This leads us to our second symptom, mood swings. Fluctuations in estrogen levels can affect mood and lead to mood swings, irritability, or increased anxiety. Third on the list is breast tenderness. High estrogen levels can cause breast tenderness or swelling. If you're noticing lumps or nodules in your breast, that brings us to our fourth symptom, fibrocystic breasts. Estrogen dominance may contribute to the development of fibrocystic breast changes. Next, we have weight gain. Estrogen dominance can contribute to weight gain, particularly around the hips, thighs, and abdomen. If you're feeling fatigued or have a lack of energy, that could be due to excessive estrogen levels, which is symptom number 6. Symptom number 7 is insomnia. Hormonal imbalances, including estrogen dominance, may disrupt sleep patterns and result in difficulty falling asleep or staying asleep. If you're experiencing headaches or migraines, that could be due to estrogen fluctuations, which is symptom number 8. Symptom number 9 is decreased sex drive. It's not uncommon for estrogen dominance to lead to a decreased libido or reduced interest in sexual activity. If you're experiencing water retention, high estrogen levels could be the cause. This could lead to bloating or swelling in the hands, feet, or face. If you're noticing brain fog, difficulties with memory, concentration, or mental clarity, that could be due to hormonal imbalances, including estrogen dominance. Hair loss is symptom number 12, and changes in estrogen levels can contribute to hair thinning or hair loss in some individuals. Moving on to digestive issues, estrogen dominance may be associated with symptoms such as bloating, gas, or constipation. Allergies or sensitivities is symptom number 14. Elevated estrogen levels can increase sensitivity to allergens and may lead to allergy symptoms or increased sensitivity to certain foods or environmental triggers. Symptom number 15 is thyroid dysfunction. Estrogen dominance can affect thyroid function, potentially leading to symptoms such as fatigue, weight gain, or changes in body temperature. If you're experiencing acne or other skin issues, that could be due to imbalances in estrogen levels, which is symptom number 16. Joint pain is symptom number 17. And estrogen dominance may be associated with joint pain, inflammation, or stiffness. Cold hands or feet is symptom number 18, and hormonal imbalances, including estrogen dominance, can affect blood flow and lead to cold extremities. If you're experiencing increased PMS symptoms such as mood swings, bloating, or breast tenderness, that could be due to estrogen dominance, which is symptom number 19. Last but not least, estrogen dominance has been linked to the development of uterine fibroids, which are non-cancerous growths in the uterus. And there you have it, 20 signs that may indicate estrogen dominance. If you resonate with these symptoms, it's important to discuss them with your healthcare provider to determine the best course of action for you. Have you ever heard of bioidentical progesterone? It's often considered an important component in addressing estrogen dominance. And today, I want to tell you 10 reasons why bioidentical progesterone is key in managing estrogen dominance. First, Bioidentical progesterone helps balance estrogen levels by counteracting the effects of excess estrogen in the body. It works to restore the natural balance between estrogen and progesterone. Secondly, progesterone plays a crucial role in regulating the menstrual cycle. It helps prepare the uterus for pregnancy and supports healthy ovulation. By ensuring adequate progesterone levels, estrogen dominance can be mitigated. Thirdly, bioidentical progesterone can help alleviate the symptoms associated with estrogen dominance, such as breast tenderness, bloating, and mood swings. If you're someone who struggles with anxiety or has a hard time relaxing, listen up. Progesterone actually has a calming effect on the brain that can alleviate anxiety and promote a sense of relaxation. Fifth, excessive estrogen without adequate progesterone can lead to an overgrowth of the endometrium, the lining of the uterus. Bioidentical progesterone helps protect the endometrium and reduces the risk of endometrial hyperplasia or cancer. Sixth, think about your bone health. Progesterone plays a role in bone formation by promoting the activity of osteoblasts. Maintaining adequate progesterone levels can help prevent bone loss associated with estrogen dominance. Seventh, let's talk about sex drive. Estrogen dominance can lead to a decrease in libido, but bioidentical progesterone can help restore a healthy sex drive by balancing hormonal levels and enhancing overall well-being. Eighth, did you know that sleep disturbances are often associated with estrogen dominance? Progesterone has a calming effect on the central nervous system, which can help improve sleep quality. Balancing hormone levels with bioidentical progesterone can aid in restoring healthy sleep patterns. Ninth, PMS symptoms can be unbearable for some individuals, but bioidentical progesterone can help alleviate the symptoms of PMS, which can be exacerbated by estrogen dominance. It can reduce mood swings, irritability, bloating, and breast tenderness associated with PMS. Lastly, bioidentical progesterone works synergistically with other hormones in the body, helping to maintain overall hormonal balance. By restoring progesterone levels, it can help optimize the balance between estrogen, progesterone, and other hormones. It is important to note that individual responses to bioidentical progesterone may vary, so it's recommended to consult with a healthcare professional who specializes in hormone therapy to assess your specific hormonal imbalances and determine the most appropriate treatment approach for you.
Have you ever heard of estrogen dominance? It's when there's an excess of estrogen in the body, and it's been suggested that it could contribute to the development and progression of autoimmune diseases. Autoimmune diseases are conditions where the immune system mistakenly attacks healthy cells and tissues in the body. While the exact causes of autoimmune diseases are complex and multifactorial, hormonal imbalances, including estrogen dominance, have been shown to be part of the problem. But don't worry, there's good news. Restoring progesterone levels can actually help autoimmune patients, and here are some of the reasons why. Firstly, progesterone has immunomodulatory properties, which means it helps regulate immune responses. It has been shown to have anti-inflammatory effects and can help modulate the immune system's activity, potentially reducing the excessive immune response seen in autoimmune diseases. Secondly, estrogen dominance can shift the balance between Th1 and Th2 immune responses. An imbalance towards Th2 dominance is often observed in autoimmune diseases, but progesterone can help restore the balance between Th1 and Th2 responses, promoting a more balanced immune system. Thirdly, T regulatory cells play a crucial role in immune tolerance and preventing autoimmune reactions. Progesterone has been shown to enhance the function of Treg cells, which can help suppress autoimmunity and promote immune tolerance. Progesterone also has some other fantastic benefits, one of which is reducing chronic inflammation. Estrogen dominance can contribute to it, but progesterone has anti-inflammatory properties and can help reduce inflammation in the body, potentially alleviating symptoms and reducing disease activity. But wait, there's more. Progesterone can also help modulate cytokine production, which can promote a more balanced cytokine profile and reduce inflammation. It's not just the immune system that can benefit, as autoimmune diseases can affect the central nervous system, leading to neurological symptoms. Progesterone has neuroprotective properties and can help protect against damage to nerve cells, potentially reducing neurological symptoms associated with autoimmune diseases. The adrenal glands produce hormones, including progesterone, that help regulate immune and inflammatory responses. Hormonal imbalances can lead to adrenal dysfunction, which is often associated with autoimmune diseases. Restoring progesterone levels can support adrenal function, promoting overall hormonal balance and resilience to stress. Finally, in the case of estrogen dominance, it can lead to increased oxidative stress, which can contribute to tissue damage and inflammation. Progesterone has antioxidant properties and can help enhance the body's natural antioxidant defenses, reducing oxidative stress and its damaging effects. It's worth noting that the effects of progesterone in autoimmune diseases can vary depending on the specific condition and individual factors. As always, treatment decisions should be made in consultation with a healthcare professional experienced in managing autoimmune diseases and hormone therapy, who can assess your unique situation and guide you in determining the most appropriate approach to hormone balancing and autoimmune disease management.
Now let's talk about how adding low-dose naltrexone, LDN, to a regimen that includes natural bioidentical progesterone can potentially have a positive impact on estrogen-dominant patients. LDN is a low-dose medication that has been studied for its effects on various conditions, including autoimmune diseases. When combined with bioidentical progesterone, the results can potentially benefit estrogen-dominant patients in multiple ways. Firstly, both LDN and progesterone have immune-modulating properties, which means they can help restore immune balance and reduce autoimmune-related inflammation in estrogen-dominant patients. LDN works by modulating opioid receptors and reducing inflammation, while bioidentical progesterone also has immunomodulatory effects. Secondly, LDN helps enhance endorphin production by blocking opioid receptors for a short period, which triggers the body to produce more endorphins. Endorphins are natural pain-relieving and mood-enhancing substances that can potentially improve symptoms such as pain, fatigue, and mood disturbances often experienced by estrogen-dominant patients. Thirdly, LDN has shown promise in reducing neuroinflammation, while bioidentical progesterone has neuroprotective effects. Together, they may help alleviate neurological symptoms and improve cognitive function in estrogen-dominant patients. Fourthly, bioidentical progesterone helps balance estrogen levels in estrogen-dominant patients, while LDN can modulate hormone receptors and potentially enhance hormone sensitivity. The combination of these two treatments can work synergistically to restore hormonal balance and alleviate symptoms associated with estrogen dominance. Fifthly, LDN has shown analgesic properties and can help reduce pain perception. When combined with the anti-inflammatory effects of progesterone, the combination can provide comprehensive relief from pain and inflammation. Lastly, estrogen dominance can negatively impact overall well-being, causing fatigue, mood disturbances, and a decreased quality of life. LDN and progesterone can have positive effects on energy levels, mood, and overall sense of well-being, helping estrogen-dominant patients regain their vitality and improve their quality of life. It is important to note that the use of LDN and bioidentical progesterone should be done under the guidance of a knowledgeable healthcare professional experienced in treating estrogen dominance and autoimmune diseases. Treatment plans should be tailored to each patient's specific condition and medical history, and healthcare professionals can monitor the individual response to treatment and adjust the dosage and combination of medications as necessary. Estrogen dominance can often cause challenges for people trying to lose weight. However, recent studies show that taking natural progesterone and low-dose naltrexone, LDN, together could make a significant difference in weight loss efforts for individuals with estrogen-dominant conditions. One reason for this is that estrogen dominance can lead to a disruption in the balance between estrogen and progesterone in the body, which can contribute to both weight gain and difficulties in losing weight. Taking natural progesterone helps to restore hormonal balance by counteracting the effects of excess estrogen, potentially supporting a healthy metabolism and facilitating weight loss. LDN may serve as an additional factor in weight loss efforts. Estrogen dominance, along with autoimmune conditions that often come with it, can lead to chronic inflammation and metabolic dysfunction. LDN has anti-inflammatory effects and may help reduce inflammation and improve metabolic function, meaning it may indirectly aid weight loss efforts. Furthermore, LDN has been shown to modulate opioid receptors, which can influence appetite and cravings. By temporarily blocking these receptors, LDN can help reduce cravings for unhealthy foods and regulate appetite, potentially leading to better dietary choices and weight loss. Fatigue, mood swings, and low energy levels can impact motivation for exercise and maintaining a healthy lifestyle. Estrogen dominance can often contribute to these symptoms. Natural progesterone and LDN have been shown to improve energy levels and mood. By alleviating these symptoms, they can help individuals feel more motivated to engage in physical activity and make healthier choices, which is likely to lead to weight loss. Finally, LDN triggers the body to produce more endorphins, which are natural pain-relieving and mood-enhancing substances. Increased endorphin levels may lead to a more positive outlook, increased motivation, and an improved ability to engage in physical activity, all of which can help aid weight loss efforts. It's important to work with a healthcare professional experienced in hormone therapy and autoimmune conditions to develop a personalized treatment plan, monitoring your progress, adjusting medication dosages, and providing guidance on diet, exercise, and lifestyle modifications, ultimately facilitating overall health and sustainable weight loss. Remember, individual responses to natural progesterone and LDN may vary. Weight loss should not be the sole focus of treatment for estrogen dominance.
So you're looking for information on how to get started with hormone therapy or autoimmune conditions, and you're not quite sure where to begin. Well, the first step is to consult your primary care physician or gynecologist. They can provide you with recommendations or refer you to a healthcare professional who specializes in hormone therapy or autoimmune conditions. Another great option is to join local support groups or online communities focused on hormone health or autoimmune diseases. These groups can connect you with other individuals who have had success with LDN and hormone restoration. They may be able to share recommendations for compounding pharmacies or physicians in your area. In addition, researching compounding pharmacies is a good idea. Look for ones that have experience in preparing hormone therapies and check their websites, or call them to inquire about their expertise and if they work with LDN. They may also be able to provide recommendations for healthcare professionals who prescribe this combination therapy. You can also search for healthcare professionals who specialize in hormone therapy, such as functional medicine practitioners, integrative medicine doctors, or anti-aging specialists. They may be familiar with the use of natural progesterone and LDN in their practice. Finally, it's important to have a thorough discussion with your healthcare provider before starting any new medications or treatment regimens. They can assess your specific health needs, review your medical history, and determine if natural progesterone and LDN are appropriate for your condition. Remember, the information provided here is for general informational purposes only and should not replace professional medical advice. It's always best to consult with a healthcare professional for personalized guidance and recommendations based on your specific circumstances.
In today's episode, we discussed estrogen dominance, its symptoms, and how bioidentical progesterone can help balance hormones, improve immune function, reduce pain and inflammation, and aid in weight loss. Remember to consult a healthcare professional before starting any new treatments, and thanks for listening.